Shootings have indeed put mental health firmly in the spotlight. It's an issue that Florida lawmakers have been struggling for years to address, but they made some progress this year with a record $126 million budgeted for mental health related issues. Fox 13's Kelly Cowan joins us live now in our newsroom. And Kelly, there's a local nonprofit that provides mental health services in Hillsborough that's getting some of that money, right?
That's right. And we're talking about more than $3 million that's going to help build a new hospital and shorten the wait list for those who urgently need care. Florida's mental health system has long been grappling with its own crisis.
There's a wait list for just about every mental health, behavioral health service in this community as well as in the state.
According to Mental Health America, Florida ranks nearly dead last in the nation in access to mental health care, which means many people suffering from mental illness simply go untreated.
Untreated mental health can bring a life of cycling between emergency rooms, crisis centers, and jails.
Hillsborough Representative Jackie Toledo is hoping to break that cycle. Today she presented more than $3 million in funding to Gracepoint, a mental health nonprofit in Hillsborough's Baker Act receiving facility.
I believe mental health is the root cause of a lot of the criminal activity that we see, and we can prevent that from happening, give people the resources that they need, the mental health treatment that they need. I think it would prevent them from committing crimes.
The money will help build a new hospital and expand Baker Act services.
Opening these beds takes the pressure off the state hospital system.
Gracepoint also hopes expanded access to care will take pressure off area jails as well.
Major recidivism, major goal of ours is to put a lot less strain on the system that we have, which is already overburdened with not enough resources, and this is a huge help.
And Gracepoint CEO says Florida has made big gains in its funding of mental health treatment, but there is still a lot of work that needs to be done in order to ensure that everyone who actually needs help gets access to care.
Yeah, the $3 million will go a long way, but certainly much more is needed to address the need that's out there. Thanks, Kelly.